I'm presenting a case of a papillary thyroid carcinoma. This is a case for papillary thyroid carcinoma, which is considered to be the most common cancer of the thyroid gland. This case belonged to a female patient in her 40s, present with the right neck or right nodule. Based on the microscopic description, as we were called in by the radiologist, we were able to pin down the PTC right away due to the classic feature that we were able to see. I am going to present those features for you to kind of give you an idea what does it look like, what does PTC look like. In this slide, look at the lines, which we call grooves, in the nucleus. On the second slide here, you look, some of them, if you look at in the nucleus, you see some INCI, we call it INCI, it refers to intranuclear cytoplasmic invagination, where you can almost like see the cytoplasm through them. And we're not talking about any ordinary circle. Usually they have to be really, they have to be like almost similar to the fingerprints, where it has certain structure to it, which of course medical professional can recognize right away on the slide whether those are false INCI or the right INCI. The other feature we looked at is the architect. If you see those cells, the way they are spreading, it's like almost 3D structure, and that's where we call it papillary. The other feature on this slide, the histology slide, you see the colloid, and we can appreciate the colloid a lot better in this slide, where you see almost the colloid forms a plate, pinkish, surrounded by all these cells. We call this as gummy colloid. In normal cases, in benign cases, usually you would have colloid in massive amount and it would be watery. It wouldn't be as thick. In this case, you see it really thick, which is another feature that you can't see. If you're lucky, you get all these features all together. It doesn't necessarily mean that in all PTC you would see all these features. You might be lucky sometimes if you have them all to give you the assurance, yes, we are looking at PTC. It's like a puzzle. We have to put all the pieces together in order for us to come up with one diagnosis. Of course, the treatment for this patient was thyroidectomy and hormonal therapy. What's worth mentioning is that if you ever have any abnormal growth on the body, the best thing is to check it out right away, because timing is very important in cancer. You do not want it to spread over to stage 2, 3, 4. In my coming cases, we would have some interesting ones about lung cancer, and I hope that I'm going to be able to share as much as possible with all of you to kind of give you an idea what does also lung cancer look like, because it's pretty much most common cancer that can be missed on stage 1, and we try to educate people about all this type of cancer. Thank you for your time. If you have any comment, please make sure you leave them in the comment area and we will respond back to you as soon as possible. Thank you for your time and have a wonderful day.